Hello everyone, myself Dr. Tapas Pal and welcome to our channel Physiomax Organization. Under the part of Physioversity, we are continuing our anatomy education. And today we will be reading one of that part that's one of the most important long bone of the upper limb. Yes, today is the first osteology class about the bony anatomy. As in the last class you have already read about whenever we will be reading any sort of osteology, the way we will be reading the osteology portion. That means under the 7 points we will be reading the osteology. You can check up in the pop out about the video. So today directly we will start about the bony anatomy or osteology of humerus. So in my hand I am holding a humerus bone. So this is what's the humerus. So whenever I will be holding the humerus, first things I need to know that is about the anatomical position. Anatomical position of the bone, that means the way I will be holding the bone. So I am holding the bone in the anatomical position where the head of the humerus, it needed to be faced upward and the lower end it needed to be faced downward. So this is the upper end which is facing upward and this is the lower end which is facing downward. Now the second point of the anatomical position is which is the anterior and which is the posterior aspect. So as per this humerus, this is what is the anterior aspect and this is what's the posterior aspect. In the anterior aspect, on the up near the head and the neck of humerus, you can find out two very important tubercle over here. And on the posterior aspect at the lower end, we can find out a hollow region. Later on we will come to know about its names. So that's the two very important findings by which we will understand which is the anterior and which is the posterior. As the humeral shaft, it's bit of triangular in shape from the lower end, the angle is formed in the anteriorly and the posterior surface it's bleed flat. That's the another third point by which we understand the humerus, which is the anterior and which is the posterior. So with these 3 points, we will be ending up the first point of understanding the bony osteology, that's the anatomical position. Coming to the second point, that is the side determination. That means what is the side determination? Side determination means I am holding this bone, either this bone can be of my right hand or can be of my left hand. So but how I will understand which bone this is? Either it can be a right side bone or it can be a left side bone. To understand which side bone is, we will come to know with few of the points. Number 1, always the ball of the head of humerus, it needed to be attached with the glenoid cavity of the scapula, and which needed to be faced inward medially towards your body. That's the number 1 point. Number 2 point is that and near the elbow we are having two very important bony prominence, which is the medial and this is the lateral epicondyle. And same like if I show you in the bone, you can see this is the medial epicondyle and this is the lateral epicondyle, and the medial epicondyle it's bit larger than the lateral epicondyle. So and this medial, by the name, it needed to be faced medially. So with these two very important points, we will understand now which side bone it is. So first I am holding this bone on my left hand, as this is the anterior, this is the superior. Now we can see if I hold this bone on my left hand, the medial epicondyle is facing outward. So it's wrong. Again, the ball is facing outward. So it's wrong. Now I am holding this humerus on my right hand. See, the ball of the humerus is facing towards my body and the medial epicondyle is facing medially, which is larger in shape. So by this we understood the bone is of right side bone. So with this two very important point, we will understand the side of this bone. The third and the most important part is about the ossification. Ossification, that means the maturity of a bone, and by which age the bone get matures. This bone of the humerus, it get matures with from 8 ossification center. And this ossification center, the primary ossification starts from the during the phase of natal. That means when the child in a womb, that's the time the humeral ossification starts. Mostly it starts from the 7 months of the intrauterine life. And normally this primary ossification aids within the age group of 3 to 4, and from when the secondary ossification starts and it's end up in the age of 21. So primary ossification center, it ends in the age of within the age of 3, and the secondary ossification center, it's in the age of 21. So total we are having 8 ossification centers in this. Coming to the fourth important point, that is about the border and the surface. This humerus, we can see, as I have told in the earlier of the video, the humerus is in the shaft, it's bit of triangular in shape from the shaft. We can see over here there's a anterior border. As I told, this is the medial epicondyle. From the medial epicondyle leaf, you can see there's the medial border, and on the lateral side you are having a lateral border. So there is a 3 border. One is the anterior, this is the medial, and this is the lateral border. Now we will see if these are the 3 border, then what's the surface? As I told, this is the anterior border. As I told, this is the anterior border. You can see the surface from the anterior to medial, that's the anterior medial surface. As this is the anterior border and this is the lateral border, so there's the anterior lateral surface, and on the back this is the posterior surface. So we are having a 3 border and 3 surface. Once more to repeat, this is your anterior border, the line. This is your medial border, the line, and this is your lateral border, this line. And as these 3 border makes the 3 surface, we can see the anterior medial surface over here, we can see the anterior lateral surface over here, and we can see the posterior surface over here. So these are the 3 border and the 3 surface of the humerus. And the another point we will read from today's class, that's the bony landmarks. So today we will read another most important parts of this particular humerus, that's the bony landmarks. As I told, there's the head of the humerus, this is the neck of the humerus, this is the shaft of the humerus, and this is the lower end of the humerus. This is the head, which consists of a ball. And you can see this ball, which is to get articulates with the glenoid cavity of scapula, and that's how it makes a ball and socket joint, where the socket is fixed some of the times, although the scapula moves, and the head of the humerus is to rotate as per the flexion and abduction. Coming, you can see exactly over here there is a rim. And this rim, it is for the attachment of the glenoid cavity, and the name of the rim is the glenoid rim or glenoidal rim. Over here you can see 2 of the most important bony prominence. One is upward, one is downward. The upward one, it's named as a greater tubercle, and the downward, which is called as a lesser tubercle. And in between both the tubercle, you can see there is a space which is named as a intertubercular space or sulcus. Again, once more to repeat, where we can see a greater tubercle over here, we can see a lesser tubercle over here, and you can find out a space over here. You can see over here, this is the space, and there's the intertubercular sulcus or space. And the importance of this intertubercular sulcus of the space, the long head of the biceps tendon used to pass from here, and there is a transverse humeral ligament which is to present in this particular region, and that's what is the importance of this particular space, to protect the long head of the biceps tendon. So that is about these 2. Coming to the down into the neck, in the humerus we are having 2 types of neck, although there are 3 types. One is the anatomical, second one is the surgical, and the third one is the morphological. So first we will understand which is the but the most important is the two. One is the anatomical and the second one is the surgical. Which is the anatomical neck? In this humerus, if I just hold the ball of the humerus and if I hold this region, this is what's the anatomical neck of humerus, and this is what's the surgical neck of the humerus. So once more to repeat, this is the anatomical neck of the humerus and this is the surgical neck of the humerus. This is the shaft of the humerus. In the shaft of the humerus, just towards the lateral aspect, we can see a rough surface in this region, and that rough surface is the deltoid tuberosity. That rough surface is the deltoid tuberosity, and that is for the insertion of the deltoid muscle in this region. So this is the deltoid tuberosity. Clear? Now we will see, as I told, the border, how the border, you can see from the medial epicondyle and from the lateral epicondyle there are two lines, and these two lines are the lips which makes another border and the surface. We can see a medial, we can see a lateral lip or intercondylar lines which goes upward in this region. So this is still over here about the shaft. End of the humerus, it's having a two important bony prominence. This is the rounded capitulum and this the flattened is the trochlea. So this is capitulum. Once more to show you, this is the capitulum and this is the trochlea. So above the capitulum you can see there is a small groove, and above the trochlea also as there is a small groove. Above the capitulum there is a small groove which is named as radial fossa, and above the trochlea there is a small groove which is named as a coronoid fossa. So this is for the attachment. So above the capitulum is a radial fossa for the attachment of the radius, the upper head of the radius. When you go for the elbow flexion, the head is to get attached, and above the trochlea there is a coronoid fossa or groove. If I just make a turn, here you can see the another groove, that's for the attachment of the olecranon process of the ulna which makes the elbow joint. So you can see the olecranon groove over here, and this is what's the olecranon groove, and this is what's the lower end of the humerus. So with this we will end up of today's class, and we came to know about the most important 4 points about the osteology of the humerus. The number 1, it was the anatomical position. Number 2, it was the site determination. Number 3, it was the ossification. Number 4, the border and surface, and of course we have read another most important, that's the bony landmarks of humerus. In the next class, the most important, we will read about the muscle attachment. With that we will read the clinical anatomy. With that we will end up. So stay tuned with us. Those who are new for this channel, don't forget to subscribe the channel, and those who are seeing our educational series, don't forget to like the video. Thank you.